Hi, I'm Carol Higgins. Welcome to Facebook Live. We're coming to you from Miami Cancer Institute today. We had a couple of technical issues, so this isn't actually live. This is what we call live to tape, but we're going to go ahead and have the discussion, and we're going to answer some of the questions we've already received from viewers. So to kick things off, let me tell you that it is National Oral Head and Neck Cancer Awareness Week, and we're in recognition of that here. The gentleman here just did some screenings earlier for the public. We'll talk more about that in a minute, but first, let me introduce our panel. This is Dr. Jeffrey Young, Chief of Head and Neck Surgery at Miami Cancer Institute, and next to him is Dr. Noah Kalman, who is a radiation oncologist at MCI. So we hear a lot, guys, about breast cancer, lung cancer, prostate cancer, but we don't really hear so much about head and neck cancer. Dr. Young, if we could start with you, can you kind of put us on the same page? What are we talking about here?
So I like to describe head and neck cancer as pretty much everything above the collarbone, outside of the brain.
Okay.
So, we deal with cancers of the throat, cancers of the mouth, cancers of the skin in the head and neck area, as well as cancers of the salivary glands and thyroid cancer. So that's all in, that general area.
Okay, and what kinds of people or populations are most affected by this, Dr. Kalman?
So head and neck cancers just in general make up about 4% of cancers that we see in the United States every year, and we really run the gamut in terms of patient types. You have, more classically, we used to see patients who had risk factors of smoking or alcohol intake, but now we actually see a lot of younger patients in their 50s, 60s who really don't have significant risk factors like that.
So HPV is interesting. Let's talk about that a little bit more for a second. There is actually a vaccine for HPV, and there's a lot of misinformation right now about vaccines out in the public with measles epidemics that are happening because people don't understand and they're getting bad information. So we have the experts right here. What is the HPV vaccine? What does it do, and who should get it?
So the HPV vaccine is a cancer preventative vaccine. The current vaccine targets 9 potentially cancerous strains of HPV. And so by eradicating these strains and providing immunity, you can significantly reduce cancer risk. So the vaccine was actually approved up to the age of 26 for many years and has now been up to the age of 45. So I am 43 and I had my vaccine, so I recommend that everybody should have it. If you have something that can prevent a cancer with, absolutely, minimal threat to your health, why not do it?
Sounds good. And so you would suggest for parents to get their kids vaccinated?
Absolutely. The earliest you can do this is 9 years old. The recommended age is, I believe they're trying to do it at 11 when there are several other vaccines that are given at that same time.
Mm-hmm.
Yeah, and I echo that statement completely. That in addition to head and neck cancer, that this vaccine can prevent is also effective in certain GI cancers as well as cervical cancer, and there are sort of more that we're discovering. So it's really an excellent thing to do for cancer prevention.
I love to hear that, cancer prevention. We don't really hear that often, but this is an actual method. What kind of symptoms are associated with these cancers, Dr. Kalman?
So many of them, especially when we're talking about oral cancers, many of them develop with a sore lesion in the mouth that starts and really persists. So many things that you get either from an infection or say you ate something that was too hot, that over a week or two will go away, but these are things that will persist over time. And then other symptoms that people can get are things such as difficulty swallowing or painful or having pain with swallowing. You can have bleeding in the mouth, and then sometimes you can have something as simple as just a swelling in the neck that doesn't go away.
Okay. Well, earlier today, as we mentioned, you guys provided free screenings to members of the public, and I know you've done that over this past year. You did it down at the NASCAR championship races and at the Coconut Grove Arts Festival. What goes into a screening? What exactly were you doing?
So the type of screenings that we do publicly, we're mainly looking for obvious signs of head and neck cancer, just like Dr. Kalman talked about. Lesions in the mouth, lumps in the neck, things like that that we can do in a community screening event. One of the other symptoms is changes in your voice, which will require looking directly at the vocal cords, which we obviously cannot do in that kind of screening. So anyone who's having those symptoms, we recommend that they follow up and get a camera endoscopy to look down at the vocal cords in the back of the throat in areas that we can't see on a normal screening physical exam.
And do people need to come to a specialist for that kind of screening, or for the general screening?
Normally this is done primarily by dentists. Do most of the oral cancer screenings is done by dentists and should be done at least once a year when people do their regular dental visits, and primary care providers can do this as well. But we recommend that you have a screening exam at least once a year.
Now, when we're talking about screening, we're kind of looking at people who may not necessarily have symptoms,
That's
right?
absolutely right.
Okay.
Yeah, exactly.
And to catch cancer early, we always hear how important it is to catch it early. Why is it so important? What difference does it really make if I catch it early or not?
So generally when tumors are caught earlier, then there are more options for treatment, and generally our ability to either excise the cancer completely or to treat it effectively, that's better the earlier that we catch the tumor. So the earlier is always better to catch it.
Very good. When someone has a diagnosis of head and neck cancer, I know that you guys here take pride in having a multidisciplinary approach to treatment. Can you explain, Dr. Young, kind of what that means and how it benefits patients?
Absolutely. So cancer care is, of course, very intricate, and specifically in head and neck cancer, there's what I often say, a lot of important real estate up here. You've got major arteries, major nerves. You have cosmetic issues. This is people's faces and appearance that can be affected by some of the forms of treatment that we offer. So even though there may be a surgical option, it may not be what's best for the patient, and whereas a radiation option may be better in that case. So instead of having the patient having to go see a surgeon, then go see a radiation oncologist, or maybe even a medical oncologist and a dentist, and delay their care by weeks and weeks and weeks, we've consolidated that into one appointment where we have dental, head and neck surgery, radiation oncology, medical oncology, all subspecialize in head and neck cancer treatment, all see the patient at the same time, to try and really help streamline their care and make this a very patient convenient kind of format.
And I understand you probably have tumor boards for this as well. Is that right, Dr. Kalman?
Yeah, exactly. And so generally we discuss cases prior to meeting the patient, and then afterwards we can discuss the cases again after additional imaging or workup has been done. And it really allows us to talk through the case and come and make a consensus plan of the treatment course that's best for each patient, and then come back with really a unified plan and next steps moving forward with treatment.
And we use our neuroradiologists and pathology colleagues as well at that conference to add another area of expertise. These are people who normally wouldn't be there during the office visit, but can give a tremendous amount of input into the cases at the tumor boards.
Very good. How is radiation actually used in treating these cancers?
So radiation is one of the pillars of treatment, and we use it often after surgery, not all the time. Oftentimes surgery is all the patients need, but either after surgery or often in lieu of surgery or instead of, that we'll treat with radiation either alone or with chemotherapy.
And I think that there have been many advances recently in both radiation technology and surgical technology. We have surgical robotic systems now that allow us to reach back further in the throat than we've ever been able to reach with other platforms. There are new platforms coming out all the time. So technologically, the surgeries have gotten more and more advanced and more available to people. But still, like Dr. Kalman said, there may be a need where the patient can't have surgery, or surgery is going to cause too much issues and morbidity that they would need another form of treatment, and that's where radiation can also be used as well for those cases where surgery is not indicated.
I know there's a lot of exciting news in the cancer world about immunotherapy, targeted drug therapy. Is there anything on the horizon for these cancers, for those types of approaches?
Yeah, I think that so immunotherapy, or using medications to help to activate the body's immune system to fight the tumor, that those have gained in prominence over the number of years and is used in the head and neck cancer setting. And we're currently studying being able to use those drugs earlier in treatment. Right now, we use them only in patients who've had a very advanced disease, but we're looking at using that in the curative setting for patients if it can enhance our ability to control these tumors.
I was very lucky to be at Johns Hopkins in the laboratory and worked in the laboratory of one of the pioneers in immunotherapy and was there kind of at the birth of immunotherapy. So it's been amazing to see the rollout of this, which was initially targeted for melanoma and then came lung cancer, and then the door has been opened, and now we're seeing head and neck cancers being approved for, or immunotherapy agents being approved for head and neck cancers. A lot of times this is when nothing else works, but I think that we're going to see that being moved forward, and some of these things are going to be in the initial treatment regimen. We do have some clinical trials going on now looking at that particular aspect. Is this something that we can use early on rather than late in the game? And I think it has the potential to be game-changing.
That sounds very exciting. Clinical trials, do our patients have access to a variety of clinical trials here at Miami Cancer Institute?
They do, and we have some clinical trials open. We're trying to open several more. Of course, we have our alliance partnership with Memorial Sloan Kettering, which also facilitates with clinical trials and research as well.
Okay. Let's see. We've talked about HPV, we've talked about risk factors, and now I'm told we have a question from one of our viewers who left it earlier, and he say, I suffer from migraines. Should I be concerned about head and neck cancer?
So, there's not a definitive link between migraines and head and neck cancer specifically, but anybody with worsening migraine should always have that checked out, usually beginning with a neurologist. There may be, especially if there's been a history of cancer in that patient and they're having worsening migraines. There are some cancers that can present with migraines, but most head and neck cancers are not associated with headaches.
What about recurrence of these cancers? If you have one kind of head and neck cancer, are you more likely to have another kind, or are they more likely to recur?
So especially when these tumors are smoking related, then the risk is higher that a second cancer could occur. In the younger patients who have the virus associated cancers, they're at a slightly higher risk than the general population, but generally after their initial tumor is treated, the odds of having something come back are very low.
Oh, another question, great. How much should I worry about a constant toothache turning into oral cancer?
So generally, it's important to have good follow-up with your dentist or oral surgeon. The vast majority of these toothaches are nothing to worry about and are just followed with time and are often due to underlying dental disease. There is, of course, we see a limited subset of patients. The dental disease that we think puts people at somewhat higher risk is something called leukoplakia, which is a chronic inflammation in the mouth. And although that's something that, again, is at a very low risk of developing into an oral cancer, it's something that you want to make sure you have very good follow-up with your dentist or oral surgeon, because we do know that is a risk factor to develop something.
And occasionally we do see head and neck cancers, especially oral cavity cancers, arising in a setting of what was thought to be dental disease, but was just misdiagnosed as infection when actually it was cancer. So I always say if you have something in your mouth that hasn't healed in a month despite appropriate treatment, it probably should be biopsied.
Okay. Better safe than sorry,
Better
right?
safe than sorry, always.
Another question, does nutrition play a factor in the development of head and neck cancer?
Not per se in the development of head and neck cancer. It is extremely important in the treatment of head and neck cancer. And I think this is why having a comprehensive cancer treatment center is very, very important. Our nutritionists play an active role with our patients in keeping them healthy, because some of these patients, they can't swallow like normal, like you and I could, or they may be depending on a feeding tube temporarily or permanently. So their nutritional needs are very important because they need those calories and that protein to get them through treatment.
Sure.
but I know of no nutritional precursors or nutritional causes of head and neck cancer that I'm aware of.
One final question, and then we'll close out. What about vaping? Has the vaping craze triggered any studies about this?
So it's interesting. We had we hosted a symposium at Miami Cancer Institute just about a month or two ago, and some of I think the studies will be coming. Some of the dentists and oral surgeons feel that they have at least anecdotally seen an increase in the number of lesions in the mouth that are either pre-malignant or potentially and in the setting of vaping. But that said, I think the jury's still very much out.
It is pretty much a recent phenomenon.
Yeah.
So
Yeah.
I know with science we want to make sure we get the facts.
Absolutely.
All right. Well, before we wrap up, do either of you want to share any last thoughts with our viewers?
No, I think that it's just very important that if you go to your dentist on a regular basis, they should be performing a oral cancer screening at least once a year. Your primary cancer or primary care provider should be feeling for lymph nodes in your neck and looking in your mouth as well. If those aren't being done, try and attend one of our free community screenings and we'd be happy to check you out. Otherwise, ask your primary care provider and dentist why they're not doing it and make them do it.
Sounds like a good plan. Dr. Kalman.
Yeah, no, I think that's a great statement. And then I think overall, just things that are healthy in general, diet, exercise, are just things that'll just help you stay healthy in the long run, both from an oral health perspective and from a general health perspective.
Well, great. Well, thank you guys. It was a great discussion. We covered a lot of territory, and we're able to answer a few questions from our viewers. We're going to repost this, and if you do have any additional questions, you can just add them to the comment section of Facebook, and we are going to collect them and get answers back to you. I'd like to remind everybody out there that MiamiCancerInstitute.com is our website, and it's a great source of information about all types of cancer, about what is offered here at Miami Cancer Institute. And there are also request an appointment with one of our specialists, phone numbers and online forms that you can use. In the meantime, please follow us on our Facebook page, and then you'll be made aware of future Facebook Lives and other events such as the free screenings that they periodically perform in the community. So on behalf of our panel and everybody at Baptist Health, we want to wish you a very wonderful day. Thank you.
Thank you.
Thank you.